So I'm delighted to move on to our next speaker, who I work with the Huntington's Disease Youth Organisation, Rebecca Mason. She's our clinical study coordinator and has been working with me on a new juvenile onset HD registry called Join HD, and she will tell you more about it.
Hello, and thank you for allowing me to present to you today. My name is Rebecca Mason, and I work as a clinical study coordinator for the Huntington's Disease Youth Organisation. I will be talking to you about Join HD, the Juvenile Onset Initiative for Huntington's Disease. Huntington's disease is a rare inherited neurodegenerative disorder with a typical onset between the ages of 30 and 50 years old. Juvenile onset Huntington's disease is an even rarer form of HD, where symptoms start before the age of 21. It manifests differently from adult onset HD and is thought to be present in approximately 5% of all HD cases. However, extensive research has not been carried out into the clinical and biological manifestations of JOHD. This lack of knowledge and awareness presents unique challenges, not only for the individuals affected by JOHD, but also for their caregivers, other family members, and the healthcare professionals involved in their care. Join HD is a global patient registry with the primary aim of identifying and locating people impacted by JOHD. Secondary aims include increasing understanding of JOHD, facilitating future research, and identifying unmet needs to improve advocacy, care, and support for patients. Join HD is a remote registry which will be carried out in multiple stages. A pre-enrollment phase will be followed by 3 separate stages, with different information being collected at each stage. Pre-enrollment for Join HD opened in March 2021. Potential participants register their interest by completing a pre-enrollment form, which collects their demographic information. Potential participants are able to access the pre-registration form in a number of ways, including through the HDYO website, by clicking on the direct link, or by scanning the QR code. Once a potential participant has pre-registered, they will have a screening call with the registry coordinator to learn more about the registry and to confirm eligibility. After this call, the participant will be sent an ID number, which will enable them to self-enroll onto the Join HD electronic data capture platform, where they will consent to take part in the registry and complete the registry questionnaires. Given the rarity of JOHD, we are aiming to recruit as many eligible participants as possible to Join HD. Participants will be referred from HDYO Service User Network, from specialty or community clinics who see HD and JOHD patients, and from partner organisations, including HD charities, family associations, and professional networks. Participants may also hear about the registry through websites, social media, advocacy newsletters, and support groups. Snowball sampling will also be used, where current participants can refer others for enrolment. Since pre-registration opened in March of this year, there have been 17 sign-ups from 6 countries around the world. A scientific oversight committee has been established, and study documents, including the protocol and participant information sheets, have been finalised. Ongoing work includes finalising the platform configuration ready to launch stage 1 later this year, submitting the registry for EHDN approval, and creating a family advisory group to be led by Helen Santini, a specialist JOHD advisor for the Huntington's Disease Association of England and Wales, and member of our Scientific Oversight Committee. Future work will include obtaining the ethical approvals needed to allow the capture of clinical data in stages 2 and 3 of Join HD. We are very grateful to our Scientific Oversight Committee, who have given us their time and expertise to help develop the Join HD registry, as well as the HDYO team of Dr. Lauren Byrne, the Join HD Chief Investigator, and Dr. Bonnie Hennig-Tressman, HDYO Research Co-Chair. The committee consists of internationally recognized thought leaders on Huntington's disease. Professor Benjamin Wilfond, based in Seattle, Washington, is an expert in the ethical issues surrounding clinical pediatrics and pediatric research. He has kindly agreed to advise us in this area. In addition to our Scientific Oversight Committee, we would like to thank our generous partners at Roche, PTC Therapeutics, and Unicure, without whom this registry would not be possible. We would welcome anyone who may be interested in partnering on Join HD to please get in touch with us, which you can do via email. We would also like to thank the JOHD families who have pre-registered and everyone at HDYO, past and present, who have worked so hard on this important project. Thank you.
Thank you, Rebecca, Lauren, for this very nice presentation. So while we are waiting for more questions, I would like to know the characteristics of the participants for the stage 1, like because they are young participants, so most likely they will be at risk, or they are juvenile cases.
So there will be juvenile cases. So to be eligible, we're looking for patients who have had a formal diagnosis of JOHD. So the people taking part in stage 1, it will be the participants themselves, the patients, and then also their caregivers where appropriate. So we'll be collecting information from both.
What age? It can be, it's like above 18, because, you know,
no, so with yeah, any ages. So we've not set any limits on age at the moment. For later stages where we're going to need to collect informed consent, because we'll be collecting more medical information at later stages, there we may need to put some limits on where their levels of understanding might be. So we might put age limits on at that point, but in those cases we'd still be interested in hearing from their caregivers. So yeah, for stage 1 there's no limits on age.
And I see there's a question from Gina D'Souza about how many we have in the registry, which Rebecca mentioned. We've just opened up the pre-enrollment this year, and I think there's 17 signups.
Yeah, 17.
And that we haven't really started. This is kind of our first public announcement of the study, and we haven't started recruitment. So please spread the word and get in touch with us if you want to know more and have more information. We really think at HDYO have a ideal standing within the community to really reach out to members of the community that aren't maybe linking in with HD centres, particularly juvenile onset Huntington's drops through the pathway, the care pathways quite often, and because of the huge disease burden on these families, it does increase reduce the chances that they're going to take part in research, and even clinicians wanting to put any more burden on these families. So we really hope that this and perhaps in the future stages we can integrate a lot more of the kind of things that were talked about in the first talk about remote assessment and telehealth, and we hope this is going to be really a platform for future research in this population. I don't know if we don't have any more questions. Yeah, Jean-Marc, don't know if you have a question.
No, I think, oh, there is one still. I'm just checking here. How many do you have? You have no, we have answered already.
Yeah, we've got that.
Oh, just one.
I guess we probably just want to close up by thanking all of the speakers from our session and thanking the committee for asking us to host.
Yeah, I think this session is the example of this multidisciplinary approach for Huntington's disease with wonderful speakers across the world. Thank you very much. Hoping to see all of you next year. Thank you.
Thank you very much, Esther and Lauren, for chairing this session. As you say, Esther, is very interesting to have such a beautiful set of different people participating and providing providing their thoughts and research. And also I very much value the fact that the community is getting more and more directly involved in research, not only supporting our research as clinicians or in whatever field. We know that we have that support, but now also having initiatives which come directly from the community. So I think this is something highly valuable, and my own personal experience with what we just heard about Join HD is a very, very interesting and rewarding one.